Hello everyone, and welcome to this demonstration on proper instrument decontamination. My name is Ekundayo Yimondi, and this is Unit 3, Assignment Decontamination video from my kitchen. Today I will be showing you how to clean 4 surgical instruments that have been heavily soiled, simulating contamination with common household substance. We will go through each step carefully, following best practice used in sterile processing. Before we begin, let's talk about PPE. Personal protective equipment I'm wearing. I have my scrubs on, my head covering, my goggles, my face shield, long sleeve gown, and the apron, anti-splash apron that came with the skull kit, and my heavy duty gloves. Proper PPE is crucial because handling contaminated instruments poses a risk of infection transmission. In a real decontamination area, we will also have ventilation system to help control exposure to biohazard material. Before we continue, this is my solar instrument from last night to overdrive. So this simulated organic debris like blood tissue and biofilm that can accumulate on surgical instrument during procedure. I allowed this to dry overnight to make the cleaning process more realistic. The instrument I will be cleaning today are hemostat clamp. They are used to control bleeding and clamping blood vessels. Second instrument is my medicine ball, scissors, used for delicate tissue dissection. My Herzing forceps with it, used to graft tissue. And lastly, for the fourth instrument, my Yankauer suction tip, used to remove fluid during surgery. Comes in 2 pads, which I remove this side, and I will moving to the sink where my cleaning solution is prepared. First, in decontamination is a wash sink. To remove surface debris, I'm using lukewarm water, never hot, because hot water can cause protein to coagulate, making the contamination harder to remove. Real enzymic detergent example. In a real sterile processing department, we will use an enzymic detergent like endozyme, O+, a multi-tier enzymic cleaner that breaks down blood, fat, and protein. So in my simulation of decontamination, I will be using the same. For example, water temperature and soaking time based on IFU. According to Detergent manufacturer instruction for use of IFU that I'm using. The recommended parameter for effective cleaning are water temperature, typically between 80 to 110 Fahrenheit or 27 to 43 degrees Celsius to optimize enzyme activity without denaturing protein. Soaking time, the minimum time will be 2 minutes, but for dry blood and body burden, soaking of up to 10 minutes is recommended depending on the detergent IFU. I will allow the instrument to soak as per IFU recommendation before proceeding to intermediate rinsing. And I believe 2 minutes has passed since I was explaining the process. I do not have a surgical or decontamination brush to wash, so for substitute I'm using a toothbrush. First instrument we're going to be cleaning will be my medicine ball scissors. To clean it, next we have the medicine ball scissors. These are used for cutting delicate tissues, so the blades must remain sharp and free of debris. I will scrub the scissors under the water for the water not to splash, and so it won't be no contamination. By scrubbing the medicine ball scissors, you have to make sure that I open the scissors and clean the bass lock, because debris can be stuck there. Have to check before I put it in my intermediate rinse. Next will be the forceps, the action forceps. Forceps like this have teeth, which makes them excellent for gripping tissue, but also makes them prone to trap biofilm. If not cleaned properly, dry blood can remain in these grooves, increasing the risk of contamination. For those, usually it's recommended to use a small toothbrush to scrub between the tooth and along the length of the instrument. As you can see, I'm checking for any residue of biofilm or biohazard. Next will be my hemostat. Climb. They go the bar slot, the ratchets, and the handles. Blood debris, biofilm can be trapped in the ratchet, as you can see, and inside the bar slot too. I'm scrubbing it with my brush. Make sure I scrub the ratchet properly and scrub between the boss lock too, as it can contain biohazard, any protein, debris, blood, dry blood from the surgery.